Good morning, world. Today, I would like to take a moment to answer a question that, although the answer has been commonly accepted among mental health professionals, I didn't realize that it may not be as well known in the general public. And that question is, what is the best method for treating depression? Well, to do this, let's go through the four most practiced methods, and you can decide for yourself. Let's start with the first one. First and most common is, or very common, I won't say most common, first and very common is, of course, the do nothing method, where somebody knows that something's wrong, they feel it, but they ignore it and just hoping that the symptoms and whatever's going on is going to go away. Of course, we know that that method doesn't usually work because what most of the time happens is that instead of getting better, you feel the person is getting worse. The depression gets more severe, the intensity gets stronger, and to the point where eventually the person does need to go to a professional and get help. Except the only thing that happens is that they've suffered longer than they had to if they had simply gotten help at the beginning. So the do nothing method really doesn't work. So I would say we should just right off the bat cross that off the list. Next is medication. The way it is right now, you can go to your primary physician, your family physician, and if you are experiencing depression, you tell them, they will do a screening, and the doctor will and often, or they can and often do, prescribe medication. Medication works to some degree, and one of the benefits of the medication is that it is faster acting than some of the other methods, because when the person starts taking the medication, within a few days or a couple weeks, they usually start to feel the effect of the medication. They start to feel better. The medication starts, I've had people call it the happy pill, where the person starts taking the medication and all of a sudden they start feeling happier, they start feeling better. But what's really happening is that the chemical impact of the medication is alleviating the symptoms. It's helping it's helping to control the feeling of the symptoms, but it's not really dealing with the core issue of the depression. So that's one of the reasons that people who do just the medication often end up having to stay on the medication longer, and even after they've stayed for quite a while, when you stop the medication, because it's not dealing with the issues, when you stop the medication, the symptoms often come back. So that is probably the biggest drawback of the medication only method, is that a lot of times when the person stops the medication, the symptoms do return. The third method is the therapy only method, where a client goes and sees a therapist and they start working on the issues that's leading to the depression. In that process, the client gets to learn the root cause of their depression, what is happening with them, what is going on, what was going on before, how are they responding to it. They learn not just about their environment, they learn how to manage the environment, they learn how to cope. They're learning a lot of new skills. I guess there's a lot of learning that happens in therapy. They're learning new skills, learning about themselves, learning how to interact with the environment that they are in, learning how to understand their triggers and what they need to do when they are exposed to a trigger, learning what to do when things start happening, when they start noticing, okay, I'm starting to feel symptoms, this is what I need to do. They pick up a lot of skills, a lot of tools to help them manage the situations that they are faced, to prevent or limit their exposure or the incidences of a depressive episode happening. So one of the drawbacks of that method is that sometimes, because it is a learning process, the client may not experience that sudden feel better that they do with the medication. So a lot of times the client may start and do 1 or 2 sessions and decide, oh, you know what, I've been there twice and I'm still not feeling completely better. So maybe this is not working and they stop going. So if when that happens, the client doesn't get the full benefits of that they could get because they don't get to experience they don't experience the benefits because they don't follow through. And yeah, it takes a longer time to start feeling the impact, but once you learn the skills, once you get to do everything, the effects are longer lasting, meaning that after you stop the therapy, after you are no longer seeing your therapist, all the skills you picked up, all the coping mechanisms that you learned are still there. So next year, next week, next month, if another situation presents or another depressive episode starts happening, the client has a better chance of managing it. The client has a better chance of keeping themselves from falling into a full-blown depressive episode because they have the skills to manage it now. The fourth is the combination of the medication and the therapy. Research has shown that the clients who do the combination method have a tendency to get better faster and have longer lasting effects. And there are two reasons for that. And it's pretty much combining the benefits of the medication only and the therapy only. When a client comes to therapy and they're drained, they're tired. Depression hurts. Even though technically it is mental, you feel it physically. And a lot of times the person may not have the energy to do the work that's required. The person may not have their body may not be able to handle all the work that is required in therapy. So that is one of the reasons that having that medication to give them that little boost helps with therapy, because the medication is giving them that temporary relief that allows them to be able to participate and do all the work that is required to help them get that longer lasting. And of course, when the client is in therapy, they're doing the medication, they're doing the talk therapy, and they're doing the medication at the same time. You have less of that situation where the client is coming and haven't seen the results and stop before the results start kicking in, because they're feeling better from the medication, so they have more of a positive outlook and are better able to sit through and manage the therapeutic part of it. So those are the four methods. Of course, as I mentioned, it's most commonly accepted that it is the combination of talk therapy and medication are the ideal situations. And of course, for if you are looking for longer lasting results, the ideal method is that therapy. But again, having the medication combined with it helps you make it through those first few weeks of therapy. So that's all we have for today. And if you or someone you know is going through something, please, as I always say, do yourself a favor. There are so many resources available. There's absolutely no reason that anyone should have to sit and suffer. All right? That's all we have for today. Good morning, world. Have a great day.